Barata. I'm a PhD at an instructor at Massachusetts General Hospital and Harvard Medical School. Have a significant experience in research examining patient and caregiver reported outcomes, and we all know that CAR-T has improved survival in patients with relapsed and refractory disease, but it's still associated with a significant toxic profile, and as a result, caregivers are required to take an active role during patient treatment. Despite this intense nature of CAR-T, patients and caregivers' perspectives remain unaddressed. Therefore, we decided to design this study to examine patients and caregivers' perspective on the most severe, distressing, and common side effects after CAR-T, as well as to explore their perspectives on the education received from clinicians in order to prepare for treatment. So we conducted semi-structured interviews to patients and caregivers, and overall what we learned is that patients experience substantial symptom burden across both hospitalization, early recovery, and still for some others during long-term survivorship, particularly in terms of fatigue, weakness, cognitive symptoms such as difficulties in focusing, concentrating, and in memory, as well as pain and psychological distress. Interestingly, caregivers provided with a unique perspective regarding the symptoms frequently experienced by patients, such as changes in usual behavior, delirium, low mood, and apathy, which patients didn't frequently report on. In addition, most participants reported being well prepared to cope with CAR-T. They were satisfied mainly with the education they received from clinicians, although some of them reported they were distressed and shocked when they were faced with severe neurotoxicity, as well as symptoms of fatigue and weakness. Still, others participants also expressed they would like to know more information on long-term side effects, including immunosuppression, and as well as time to resume prior activities and role. Overall, our results highlighted the need to provide additional education and supportive care resources to better prepare patients and caregivers, not only for CAR-T, but also during CAR-T recovery and survivorship. It's important to screen for symptoms, which is something that institutions are already doing, but we also know that sometimes there are barriers in communications, that some symptoms remain unaddressed. And here I would like to emphasize the value of patient-reported outcomes measures, which facilitate communications. And the idea is not only to administer those to patients, which of course we need to, but also to include the caregiver's perspective to know how caregivers are doing, and refer them to appropriate resources. We all know that caregivers play an important role, but sometimes they receive less attention, and they also experience clinically significant rates of distress, sometimes even higher than those experienced by patients. Part of this work, we also intervene physicians. So this work included interviewing patients, caregivers, and physicians. We are also working on the results of interviews for physicians, and the idea we are working on creating a specific patient-reported outcome measure to examine side effects of CAR-T, which we will leverage to design appropriate interventions for patients on this area as well.